Good. So thanks everybody for joining us again this afternoon. A little bit chilly outside. Hope everybody's had a good start to their February. A little disappointing, I think, for many of us Sunday evening watching a certain football game, but we will look ahead to next year. So vaccines, we're going to talk about that a little bit today, certainly flowing into our region. I saw a report this morning that we actually have almost 250,000 people now vaccinated with at least their first shot in our state. So that is good to see that. Moving ahead, our local positivity rate continues to drop, which is also good news. And then here at the hospital, we have the fewest COVID patients than we've had in months. So that's a good positive for us. We're having a little bit of conversation about the potential new stimulus package. And then just some updates and some other things. We've got some folks kind of guests with us today too. I wanted to start, Dennis, if you can do where'd Dennis go?
Yes, absolutely.
Okay, there you are. I lost you on my screen. We're going to start with roll call. So Dennis,
absolutely. All right. We got Jason Smith and Bob Couple, Carla Hagemeister.
Hello.
Lisa Sisley.
Here.
Robin Cole.
Yes, I'm here.
Linda Cook.
I'm here.
Dennis Butler. Dennis Cook.
Yes, I'm here.
Representative Mike Dodson. Gina Scroggs.
I'm here.
Mickey Dean. Kara Holly. Kelly Laub.
Here, AKA Donald Doffler.
Great. Cheryl Grice.
I'm here.
Shiloh Heger.
I'm here.
Fanny Fang.
Here.
Karen Hibbard.
Present.
Lonnie Baker. Commissioner John Ford.
Here.
Commissioner Dean McKee. Commissioner Keith Asher. Julie Gobert Walter.
Here.
Kelly Pascal. Lieutenant Colonel Terry Kelly. Charles Martinez. Steve Elstrom.
Steve is here. I'm tracking that neither Kelly or Lieutenant Colonel Kelly are able to join.
Great, thanks. Glad you're here. And we got Ron Fear and Christy Rodriguez. Did I see we have Alice Nassimi on here? There's Alice, thank you. And then Marissa is on here. All right, we got everyone. Thanks, Bob.
And Dennis, did you see that Dennis Butler's on?
Yes, thank you. Got that
We're just
noted.
having a little audio problem.
Yeah,
So
thank you.
we actually just wanted to start off today because talking about education and, K-State's back in session. School district obviously has been back now for several weeks. So we want to know, Carla, do you want to maybe give some updates from USD 383?
Absolutely, I'd be happy to. Can you hear me okay? Okay. So our data dashboard was released yesterday, and it continues to be good news, same as the community as a whole. We're at about, 92.8% student attendance, which is in a good range for us. 87% staff attendance, so that's holding steady. For us, I think the biggest challenge was always going to be, as in many school districts, keeping adequate staffing in order to keep students safe and do all the mitigation efforts that we need to do. So we're holding steady at the staff level. We are in 5 days a week now and settling into that routine. So I think that is probably it is a day-to-day juggle of who's going to be gone and where do we need subs and how can we fill in, but we are managing it, and we definitely appreciate the help from the community on getting those numbers down, and the definite flexibility of our parents and of our staff to be successful in getting our kids back in that 5 days a week. The other piece of information that I'm really happy to report, and I appreciate getting to go early on this report, because I'm going to hop out and go over to Seco Park, because we have, the health department has allotted some vaccinations this week for our 383 staff. So we are starting this week to be able to provide vaccinations to a good chunk of our staff. They'll be getting vaccinated first doses today and tomorrow, and then hopefully just continue to roll through and get our staff vaccinated as we go forward. Just moving them through that process as well, through that phase 2 section. That will definitely help significantly with our quarantine for our staff members and help our staffing concerns, but more so than anything, it just is a great, I don't know, I just can't be more grateful to the health department for working our staff in. And I know that our staff will be super excited. I'm really excited today because I know that I'll have a bunch of excited teachers, and you know, health professionals were excited when it was their time for vaccinations, and I said, you haven't seen anything till you've seen an excited kindergarten teacher. So I'm really looking forward to helping with that, and we're definitely very grateful and know what a big game changer this could be for us to have our staff vaccinated. So we appreciate that. And that's my good news.
That is good news. Very good. Linda Cook, updates from K-State.
Good afternoon. Yes, we've started our in-class modality of teaching. Our first 2 weeks, starting January 25th, was completely online. That was to kind of get us past the holiday surge potential. So we did start with the hybrid of in-person class, and it's a combination in-person and online in order to maintain the social distancing that we need to do in the classroom, but things seem to be moving along pretty well. We do have our latest statistics on quarantine and isolation. In our residence halls, we have 20 in quarantine, we have 26 in isolation, and then what's being reported to Student Life that would cover students that are outside of our own residence halls, there would be 85 in quarantine and 48 in isolation. We don't have any way of knowing for sure, but we're assuming a fairly high percentage of students have probably had COVID. But there's not really any way of knowing for sure what that percentage is. One of the things that we are communications wise is really reminding everyone, even if you get the COVID vaccine or if you've had COVID, you still need to wear the face masks on campus, and you need to do the hand sanitizing and still follow the social distancing, and we're just letting them know. We'll let them know when they can let up on that, but we've got a ways to go on that to continue to stop the spread of the disease, and understanding where these variants of the virus are going and how effective the vaccines are with that. So there's at least we're people are following those instructions pretty well on campus. We're still limiting any events on campus, no group larger than 250. We don't really have a lot of events really planned on campus. It's pretty much a mirror of what we were doing last fall semester. We do have starting to look at our, what's the summer semester going to look like? Hopefully we'll have a little more, information as it relates to the vaccine distribution, and can start to plan like a closer to normal summer, and then we'll start to dive into what we think the fall semester will look like. And again, they're watching what's happening with the vaccines and the variants. K-State Lafayette is designated as a closed point vaccination site for faculty and staff. And students would be included, but they're going to be so far off on the list in the later phases that it'll probably be summertime. Higher education isn't in phase 2 yet. We're hearing KDHE is moving it into phase 2 because of the close connection with faculty and staff, with students, and with people working on campus. So we're just waiting on that word, but we're advising all of our staff and employees register with Riley County Health Department. And I know Dillon's is now giving vaccinations, that they need to register wherever they can in all the locations, and then get the vaccine wherever they can get it the earliest. So that's pretty much, we do have, actually, we have an expert, a native of Kansas that has been working a lot, with KDHE and providing information about the safety, efficacy of the vaccines for more public awareness. I think you'll see more about that in the future, of him maybe doing some webinars for the state of Kansas, and we're going to try to help promote that through K-State.
Does anybody have any questions for Carla or for Linda? Oh, very good.
Hey, Bob, before you continue on the agenda, I did want to acknowledge I do have Vern Hendricks noted as being in attendance today, and then you'll introduce our next guest, so we have him noted as attending today as well.
Okay, perfect. So you might have noticed somebody new with us this morning, Alice Massini. And if you remember, Ed started with us on our group and has since changed his employment. But we're actually pretty excited. Alice is going to be with us going forward, which will also be good. She's our first full-time public information officer for Riley County. And she actually started like 3 or 4 weeks ago. You're almost tenured. That should be good.
I should be good to go. No learning curve,
Yeah.
right?
So really interesting background, I think. Her previously served as executive producer of Connecting Vets, which is a radio.com company, and also has worked as a reporter. She has a master's degree in strategic communication from American University and a bachelor's in broadcasting and mass communication from the State University of New York at Oswego. So you probably don't think anything of the weather here.
I don't know. I've been spoiled. We were in Savannah for 10 years also, so I haven't had this bitter cold in a while.
It's a little bit of a change. So we just want to kind of turn over to you, Alice, to get our update from the health department. And maybe, I know there'll be some questions probably about vaccinations. So.
Okay, so we are continuing to vaccinate people. This week we have moved on to those 65 and older without severe health conditions. We had been focusing on that population as they were the most vulnerable population. That was the individuals that we were seeing that were in the ICU that were passing away. So we decided to prioritize that group. So we're moving on to those 65 and older without severe health conditions. And at the same time, trying to allocate some of those vaccines for K through 12 for the school districts within the schools within Riley County. So as it was mentioned earlier, we're starting that this afternoon, and then also we'll have some vaccinations tomorrow. And then tomorrow we're also going to start to really get into our bulk of those booster shots. So those individuals that were vaccinated as part of phase 1, a lot of the healthcare professionals, first responders, they're starting to get those boosters. So we'll be doing that tomorrow and then 2 days next week also. Our efforts have been a little hampered this week by the extreme cold. We usually have longer hours, but because we can't, it's really difficult to get people to stand outside in 8 hours of negative temperature wind chills. We kind of cut the hours back a little bit. We're also continuing to vaccinate those who are homebound. I think we've vaccinated over 60 individuals who are homebound and made those visits. And we think, fingers crossed, that we've got a pretty good location and process right now. We had some hiccups at our first clinic, but things seem to be moving more smoothly right now. And I'm happy to answer any questions.
Alice, Fanny here. So I operate a local grocery store here, and so of course I'm very concerned about the safety of my family and my employees. I was wondering, I've seen different lists of when grocery store workers will be vaccinated, but I was wondering if you could bring clarity to that.
So here in Riley County, we decided to prioritize those who are 65 and older and those who have health conditions. So for the most part, grocery workers are going to be falling into that phase 4 or into a phase depending on their age.
Okay. Is there any special consideration for essential workers who have underlying health conditions?
So if they have underlying health conditions, those severe health conditions, if they're over 65, we will be vaccinating them right now. The next phase that we'll move into, once we finish these 65 and older, and also social services, who come right after the K through 12 teachers, will be those 16 to 64 with severe health conditions. So if you have employees that have severe health conditions, they'll be in this next batch, which we should be getting to in the next couple weeks, because I think we have about 5,000 people registered that are 65 and older that we need to vaccinate in these next couple weeks, in addition to boosters. So I think it'll be a couple weeks till we get to that, but it will be sooner than later for those individuals.
Got it.
Hello.
And last question is, when you say you'll contact people, how do you call, email?
So we're doing it through Everbridge, which is a Kansas emergency notification system. So we have your email, text, and phone, and we will send this notification, much like a tornado warning, out to you. So you'll get it on text. If you don't confirm that you got it on your text, then we'll call you. If you don't pick up the phone, then we'll send you an email. So we'll get you somehow. Just look for that notification, and we'll do that for your booster shot also, as that's how we'll notify you for that booster shot.
All right. Thank you, Alice.
Yep.
Alice.
Hello, Alice.
I say,
Hi,
Alice, just
Alice.
to clarify, people need to sign up though, right?
Yes, they need to register. So that's a big thing. Thank you for pointing that out, Bob. Is Fanny, they should go ahead and register, even if somebody's going to be in phase 3 or phase 4, because when we get to these other phases, we're doing it on a first come, first serve basis. So 65 and older, it's going to be not first come, first serve. It's going to be in the order in which they registered, I should say. So if you register that first day we open it up, chances are you're going to be towards the top of that list for that 65 and older.
Hello, Alice. This is Julie Govert-Walter with the Area Agency on Aging, and I want to applaud your focus to help get the vaccine to the people age 65 and older. We know that those are in the highest deaths and the highest risk categories. I did want to ask a little bit and get some more clarification on how the health department, what you are doing or what the plan is to reach out to the people 65 and over who are not really tech savvy. They either do not have access to a computer or they have difficulties in getting that registration. And that's my first question. I got probably 2 more.
Okay, so one of the things we've been doing is I actually took a tour of the county on Friday and went around to all the municipalities and posted flyers, and also left paperwork there at all the city halls, the libraries, put a flyer up at the short stop in Randolph. So we're doing outreach that way. I've also been working closely with the Flint Hills Area Agency on Aging and also the Riley County Senior Center to make sure that they have the flyers and are working closely with the individuals that use their services. And then additionally, this week I'm going to be reaching out to some of the housing facilities that tend to house a lot of senior citizens to make sure that they have the information that they need and that they kind of know what's available to them.
Okay, my major concern is that I think we, meaning the Area Agency on Aging, I don't know if you've talked to Kelsey Fawnin still or
yes,
her team
I have.
here.
Yep, Kelsey. Yep,
okay,
yep, yep. I've talked to her a couple times. Yep.
Okay, just because again, the major concern is helping those people who do not have technology readily available, or they might be, their caregivers may be living far away and they're just sort of, there are isolated people who really need the vaccine and probably do not know how to get it. And our agency is very happy to work with you on that. So
now, do you work with Kelsey or are you with a separate agency?
I'm Kelsey's boss.
Oh, okay,
so,
got it. Okay, cool. Okay.
That's okay. I heard that she had talked to you, and I hadn't heard any specifics, and I wanted to make sure because we know that, the meal program at the senior center, it's part of our overarching work that we do with with the meals program, the Friendship Meals program. We work, of course, with the Raleigh County Senior Center, but we also have names of people that, you know, if we could work together, of course, HIPAA compliant on an outreach initiative, we'd be happy to work with you on that.
Yeah,
So
definitely.
I just wanted, it might be worth following up after this call and chatting a little bit more. So I just wanted to ask you about that.
Yeah, no,
I think that covers it. That
Okay.
covers it for me for now, but thank you.
Yeah, I would love to do that. I was actually in the process of writing an email before I got on this to Kelsey, because she had talked about linking up through Meals on Wheels also, and kind of sending out a flyer through there, and then also some of the paperwork. And she had said that your staff is working closely with some of those individuals that don't have the technology to help register. And I would also encourage people too, if you've got a neighbor or you know somebody that doesn't have a computer, help them out. We've had lots of cases where people have emailed and said, I registered my 90-year-old neighbor. He doesn't, you know, have a computer, or he doesn't, he's not tech savvy. Can you just, you know, make sure that it went through for me? And, you know, we're more than happy to do that, and like to see people obviously helping out other people.
One more question I might ask, and I guess I'll ask, where on the list might be the people who are actually going to people's homes in Raleigh County, of course, surrounding counties too, delivering the meals? Because we want to keep those people at the lowest risk possible. A lot of them are age 60 and over, and I don't know where they fall on the list. I know everybody needs a vaccine, obviously, but I just wanted to ask you where you thought they were going to be on the list.
So if they're 65 and older, they can get on the list right now as long as they've registered. If they are not 65 and older, I'm not sure if it would fall under social services. We are going to start vaccinating those who work in social services as part of phase 2. So it might fall in there. I know I was talking to Kelsey about that, and I had forwarded Kelsey's email onto the health department. I don't know if she heard back from there, so you might want to touch base with her on that specifically.
Okay, awesome. Thank you very much.
Yeah, you're welcome.
Any other questions before we move on? All right, well, I get the honor of introducing one of our guests. In May of 2020, Kansas Governor Laura Kelly created the Strengthening People and Revitalizing Kansas Task Force, better known as SPARK, to oversee the distribution of over $1 billion in funding to Kansans through the federal Corona Aid, Relief, and Economic Security, also known as CARES. The governor very smartly chose Manhattan's own Lyle Butler to chair the executive committee of SPARK, and the task force work concluded at the end of December, as all the federal CARES funding had been expended, although I heard Lyle say that they've been instructed that they may be called back if additional funding is available. So Lyle Butler is with us today, and I am, again, very pleased to get to introduce him. He is my predecessor, and I have to work very hard to live up to his reputation on a daily basis. So please help me welcome Lyle Butler to our meeting.
Thanks, Jason. Good to see everybody. I miss being out and seeing all of you on a regular basis. So as Jason said, I guess good news, bad news is that I'm retired again from my volunteer job at the end of December. And so when Dennis called me, he asked me to just highlight a few things. And I'm not going to bore you with numbers or too many numbers. I'll give you a little bit. I think one of the things that people want to know is that we were under a deadline of spending over $1 billion. And so where are we today? And as I think some of you know, that the second stimulus bill that Congress passed in late December extended the deadline of when the monies could be expended. And that was came pretty late. And so most of the money that our committee had allocated was sent out and for the most part accounted for. In fact, the latest figures that I have Under the Spark Committee control was $1,030,000,000. And as some of you may remember, we originally had $1.25 billion for our committee, but the federal government in the CARES Act actually said any county that was 500,000 or more, they sent the check direct to those counties. So in Kansas, Sedgwick and Johnson County got the monies allocated to them and sent to them directly. So currently, for the monies that we had committed, we have just a little under $4 million that is still out and being used of the $1,030,000,000. So we had to get it out in a hurry. That was one of our handicaps, and it had to be spent by December 30th. So for the whole state, and they're still doing audits and accounting for that money. So I'm confident that here in the next few weeks, it'll reach that. What I thought I'd share with you as it relates to Riley County in specific is that actually for Riley County, out of the money that we had, Riley County received $35 million. Now I know John Ford's going to say, wait a minute, we didn't have $35 million that we were dealing with that was allocated specifically to the county. But through the CARES Act funding, as an example, separate from coming to Riley County, we gave money to education, and some of that went to Kansas State University through testing, and that just went through a different channel. So it didn't come through the Riley County Commission in the allocation, the $400 million that we allocated to the entire state. But I think it's noteworthy for this committee to know, and others in the community to know, that out of the CARES Act funding, the little over $1 billion, Riley County received $35 million, and that came through public health, essential needs, business, education, and of course the county allocation. And so, and in Riley County's case, all that money has been accounted for, has been invested, and transferred. So that's good news. A couple of things that I just wanted to very briefly cover, and you can get all of this information, by the way. Anybody in the public can get it by going to the Kansas Recovery Office, and you can get information about where the money was spent in every county in the 105 counties, how it has compiled as a statewide effort, and get a lot of detail. And in 6 or 7 minutes, I'm not going to be able to get that all to you, but a couple of things that I just wanted to share with you to give you some idea is, like in the business resiliency area, we gave money to workforce development. We gave money to business retention and expansion. We gave a lot of our money in the business area specifically to help individual small businesses, and over 5,000 businesses across the state of Kansas were helped. That still leaves thousands of other businesses that did not. We just didn't have enough money to be able to get to that. So we had many categories here. I got to kind of keep looking at some notes, and of course the counties all got money, and John and his crew were able to work with a lot of you and distribute that money locally. That was an effort. That was our first out of the door, because we thought that was the fastest way to get money out the door and start helping Kansans. We also gave a lot of money to contract tracing, testing instruments, lab capacity. So we learned as we went that we needed to get more testing done, and that would be a great way to get kids in school. It would be a great way to get employees back to employers, and try to prevent some of the help with some of the employment issues. We also gave a lot of money to state operations, and so, as I said earlier, is some of our money got to Riley County coming through various state agencies that were working in the community. So kind of where are we today? We've spent the money, and we initially, there was some thought that there was going to be some more money in the bill that was passed in December that would be somewhat discretionary for the state. but that did not occur. And so that's why the governor ended our service for the particular committee. The recovery office for the state is still open and it is still operating, and their website is active, and you can get up-to-date information on that. And the focus now is auditing it, auditing the dollars, making sure they were spent where they were supposed to be spent, because the federal regulation requires if the money wasn't spent where it was supposed to be, then the state of Kansas had to send that money back, or any money that was left over. And I don't believe there's going to be any money left over. The only thing they're doing now is the state will start auditing, and then the federal government late this year and early into the next year will be starting to go through and auditing the money that's been spent. So the recovery office is still in existence. Where are we today? You know, there's still, the state of Kansas is working with the new money that has come down, that did come through us. And I think some of you have maybe hearing or seeing things. And again, I'm referring to some notes. So healthcare has received some additional funding for testing, monitoring, and tracking efforts, as well as the vaccine distribution. This is the money that came from the federal government in late December. Education is getting some K through 12 and some COVID relief, and that has to be spent by September of 2023. And that's been obligated to the state of Kansas, but has to be spent for specific areas. And then emergency rental and utilities assistance in Kansas has received about $200 million to support that effort. And some programs are expected to launch by March 1st of this year, so just in a few weeks, that have a relationship to that. Other things that we're expecting soon, and I think I've begun to see some things in relating to transportation. There's some dollars for road transportation. There's some dollars coming for airport support. Ron Fear may know about some of those and more specifics, and some money coming from agriculture. Again, this is all coming from December stimulus, which our committee had nothing to do with. And then probably a big thing is that there's more money coming to help small businesses. And again, Jason and his folks and the Small Business Administration and local banks are helping to administer some additional loans for small businesses. And there's some pretty good money into that. And again, I think that Secretary Lorenz from the Department of Transportation, along with the governor, has received $84 million for highway funds to help with some areas as it relates to that. You know, the next stimulus plan that's coming forward, again, at the moment, and of course Congress is still, and the president are still working on modifying in those areas, but at this point it does not appear, unless there's some changes in the next week or two, that there's going to be additional dollars coming that our committee would be reconvened for, but of course that could change at any moment. So when Dennis called me, I said, you know, really I'm defunct. I don't have anything that I'm directly involved in anymore. So those are kind of a very quick, Jason, updates. I'd be glad to try to answer any specific questions, but the monies that are coming and that Congress is working on now go to very specific direct organizations. They may still come through the state of Kansas, but they're definitely earmarked for something in particular. So I do want to say that at the very end, and I see Karen Hibbard here, and at the very end, all along, we had kind of held back about 35 to $50 million, as it turned out to be, to kind of say, as we got closer to November and December, where do we need to put money? And we put a lot of it into testing, but we also went out and tried to help some more businesses, and we were able to help another 500 or 600 businesses through the state get some grant dollars. We also worked with one of the industries that was hit hard were venues. These are large and small venues across the state of Kansas that put on shows or concerts or conventions, and we gave some money to them. And then all of you know the movie theaters were hit very, very hard, and so we allocated not a lot, but specific dollar amount to the movie theaters, who I think I can tell all of you are struggling, and hopefully we can get them to continue. But we understand there's still a lot of areas of need across the state. And when the governor, I think I said this to this group the first time I spoke to you, when the governor called me and asked me, she says, Lyle, the good news is you've got over $1 billion that your committee can give out to help Kansas recover. She says the bad news is there's probably $8 or $9 billion worth of requests that you're going to get, and she was right. And so it was a very, very tough for our committee and for me personally to see what was happening in our own community, but also hearing from my other committee members what was happening in their communities and the struggles, whether it was mental health or testing, kids not in school. There's a lot of struggles across the state, and still is. But I also want to give a heads up to the county health department. The good news, I got my first shot on Tuesday. So this is the first time in my life where I was glad I was 65 and older. But I also ended up being on the healthy list, which I'm very thankful for. So although I was anxious to get the first shot, and also we helped one of our neighbors was very confused about older. So our neighbors got together and helped this person get their shot, and his wife, and they had some real health issues. So had a little trouble getting through the county system, and it was probably more their technology, lack of it. So we helped. So it's neighbor helping neighbor, and that's what we'd like to see more of. So thank you. Glad to answer any questions. I appreciate all of you and what you have done. There was a lot of communities that had a committee like this. There were lots of communities, unfortunately, that did not, and I think they struggled more. So I appreciate seeing all of you come together, and I appreciate Bob Koppel and Jason Smith being the co-chairs of this committee, and all of you putting your time in, and know that you have a lot of concerns, and still do, as we try to get our community and our state back up and running.
All right, does anybody have any questions for Lyle?
I actually do, Jason.
Okay.
This is Commissioner Ford, Riley County. Let me first start by saying, Lyle, thank you for your hard work and leadership all throughout this process. I think if that wasn't actually in place, when I say that, I don't mean just Riley County in this area, but I mean for the entire state of Kansas, they couldn't have picked a better person. With that said, it would have been very much more a difficult challenge not to have that bridge between what we needed to do here and what the state was offering at that point in time. So thank you, thank you, thank you. The question that I have, and I've heard different things about this, but is there going to be a separate pot of money available for broadband and wireless and other technological issues that fall into that equation?
Well, Commissioner Ford, as you know, one of the categories that our committee had was connectivity, because although some parts of the state, including inside the city limits of Manhattan, had some good broadband, even within Riley County, not every area and every family had access to it. Well, you multiply that, there are communities and counties in the state of Kansas that had no broadband capability, believe it or not. And yet schools were closed, and the public school system had no way of getting technologically anyway to help their students. So the answer to your question is that was one of those categories where we needed many, many, many more dollars to help get the state up and going. So we got 60 million. I think, I don't know this, Commissioner, for sure. We'd have to do a little more research, but I believe that the governor has put some dollars into her budget this year to help continue that process. I don't know how much, and obviously the legislature will make the final decisions. I know that they elevated a position within the Kansas Department of Commerce to have a full-time staff person now that is working on connectivity for the entire state. And I do know that has been done and completed, but I don't know where that budget will end up, and I don't know the amount of money. But I know that legislators saw the real need, and so I don't know whether they'll keep it in or not.
The rural part of Riley County is still effectively about 33 to 40% behind on that one. But I get the rest of the state. But given the issues with COVID and telework and telehealth and everything else, it's something that we're going to have to continue to work on and be very diligent with. So I appreciate that.
Totally agree with you. I'm very supportive, and that was one of the unanimous decisions on our 19-member committee. We had 6 legislators, 3 Republicans, 3 Democrats, and then business people and citizens from around the state on the committee, and it was unanimous that connectivity was a huge issue for the state going forward. I guess I would end and just ask this committee, one of the things our committee has done, and I think it's important for us, God forbid that we don't have another pandemic, but I think there are lots of lessons that we have learned. There's lots of things that if my committee was here, they would tell you that they would do differently. So I hope as your committee begins to wind down that you'll kind of review your actions and somewhere in a file have some recommendations if this was to ever occur again. And I hope not, but when you listen to the experts, they tell you that it was surprising that we went 100 years before we had a pandemic, and some people believe that another one could be sooner rather than later, which I hope not. But I think we've all learned some lessons. I'm sure each of you could say, yep, I would do this or this or this and differently. And I think our committee made some recommendations to the governor as well, if this needed to be convened again. Hopefully not.
All right. Any other questions for Lyle before we move on? All right, Lyle, thank you for being with us today. We appreciate it. You're welcome to stay on, or you can.
Well, I'm retired, so I got to go do something else.
All right.
Thank you all. Good to see you all.
So we have a follow-up to the survey process that we have been discussing to get a better understanding of what businesses are experiencing and trying to get a gauge of what they think about their future after the pandemic.
Hey, Jason, can we jump to Shiloh and Tammy to follow up on the Riley County Spark to follow Lyle?
Oh, I'm sorry. I apologize.
Thank you.
Yep. All right. So one of the reasons that we were able to move quickly and thoughtfully and distribute CARES funding was because of the strong partnership the state created with the counties. The governor and the Spark Committee worked extensively to distribute state funding through the counties, who then worked with the local entities such as cities, hospitals, schools, universities, chambers, and others to expend state dollars from the CARES Fund. Riley County and other surrounding counties all set up a local funding review board to get money out quickly and utilize a coordinated reporting system from the state to process and report on the Spark CARES funding within each county. 2 key people who are instrumental in coordinating the distribution of $15 million in Riley County are Shiloh Hager, Riley County Treasurer, and Tammy Robinson, Budget Director for Riley County. So I will now turn it over to Shiloh and Tammy to talk about how funds were allocated and how it helped to lessen the financial hardship to our community.
Great, thanks, Jason. So of the almost $15 million that Riley County received, after we went through our initial allocation and our round of reimbursements to the various entities, we ended up with about $180,000 that was unallocated at the end of December. And the committee met and we ended up reallocating those funds towards a lot of the expenses that our health department was still experiencing. So vaccination costs, testing kits, contact tracer costs, and then our health department personnel costs and respiratory clinic costs. So of that 15 million, there was only about 180,000, like I said, that was unallocated. In this whole process, we were able to help 183 businesses through our small business grants that we worked in conjunction with the chamber, and 31 not-for-profits that we were able to give out grants to through work with the Greater Manhattan Community Foundation. All of the other funds that we allocated to the entities were spent 100% by those entities. Tammy has filed our final report with the state that shows our full accounting of the approximately $15 million. And so we're proud to say that that is done. And Tammy's here also if you have any specific questions for either of us. Okay, well.
Actually, I'm sorry, I wasn't able to move my button quick enough. I don't know if it's appropriate to ask, but out of that monies that was given to businesses here in Raleigh County, Manhattan, are all of those businesses still, do they still have their doors open, or have we seen any businesses close out of the monies given?
All of those businesses that we gave money to are currently open.
Okay. Well, I just want to say personally, here from Russ and Kelly and, LabCo, we are very thankful for extending a branch of help here. We would not be here, quite frankly, without all of the help that we've gotten. So I really just want to say thank you very much to, everybody for helping us survive.
It definitely was not an easy process because just like Lyle mentioned, 15 million, and we had a lot more requests come in, and we had some hard decisions to make, and our committee worked very hard and really tried to come up with the best plan to touch the most number of lives in Riley County.
Okay, anybody have any other questions or comments? All right, well, moving on now to what I started before. On our survey with the Flint Hills Regional Council, the task force is the first to get the survey results hot off the press. So I'm going to turn it over to Christy and have her make that presentation.
Sure, thank you, Jason. So actually we're gonna hand it straight over to Marissa. She's been the lead on this effort. We did launch a regional survey. We serve a total of 7 counties, being Riley County, Pottawatomie, Geary, Wabunsee, Morris, Chase, and Lyon County, because we're an administrator of the Flint Hills Economic Development District. So our survey reached all of those, and Marissa did an outstanding job of finding all kinds of people that we didn't even know were out there to then personally push the survey to. So with that, thank you, Marissa, for all your efforts, and we're excited to be able to hear your report.
Perfect, thank you, Christy. I first want to thank everyone on the call and all the folks out in the community that helped to distribute the survey. We did see less responses than we were initially hoping for. We did get 132 responses across the region, and so we did get responses from every county within the Flint Hills Economic Development District. The most responses did come from Riley County, namely Manhattan, followed by Pottawatomie County, namely Wamego, and then going through. We did receive some results, though, from communities outside of Manhattan within Riley County, which was important to me because I know a lot of you know that Manhattan, Junction City, Emporia, those bigger cities that are in our counties are significantly different than the smaller cities in our counties. I did find that there's a little ghost town with 4 people that is incorporated, and I think we actually got a response from one of them. So just wanted to kind of hop on there, and what I can do if you'd like is I can share my screen, if that's okay, Dennis, and I'll go over. All of this is in draft form, just kind of to preface with that. We will be creating a dashboard and then more of a toolbox to pass along to our businesses with recommendations from the help that they were needing. So I'll go ahead and get this shared for you guys. One moment. All right, so you guys should all be seeing a PDF titled Regional Results. Is that what's popping up for everybody? Perfect. So what I'm doing is I will be creating a final report with summary sheets for each of our communities. Obviously, the main one will be the regional results, and then all of our counties will have a summary sheet. Some of the counties, we didn't receive enough responses from each of the communities to summarize it by community. As is, it's a little iffy on if it's truly representative of the businesses, but I do think that it does provide very good feedback. So to begin with, some good news. We did have 7 businesses that responded to the survey. So all of this data is only for the survey respondents. We had 7 new businesses open across our region. So yay for them. And 59% of our businesses who responded have been in operation for over 7 years. So that's huge. That's a really big key to resiliency. And obviously those folks have figured something out. And so it's definitely great to learn from them. The biggest concern in regards to just direct COVID impact to their business operations was actually the COVID exposure of staff and employees, be it quarantine, staff turnover. If you're trying to schedule your employees around that, that was the regional most cited impact. Overall, we saw about a 61% decrease in revenue, and actually about 31% of businesses who responded saw normal or increased revenue. There's going to be some more data analysis on that, as some folks who are in multiple segments, so they might have a retail segment, they might have a service segment, and so on. They saw decreases in the retail, but saw an increase in another area. Some saw increases, but it wasn't their budgeted increase. So it's definitely trying to make sure that we report that correctly and make sure that we can help all the folks regardless of what it is that they're doing. The top 5 concerns across the region in regards to what you need for your business or organization, the biggest one was customer traffic. As we've seen, if you have reduced capacity, if there's social distancing measures, if people are concerned and don't want to go out, if you don't have staffing that can accommodate multiple customers, or if you just have a small space that you just can't accommodate a lot of folks, customer traffic was the biggest one. Going hand in hand with that, losing business was the second regional concern. Again, tying back to the impact that I discussed earlier, we have our COVID-related employee absences. If you don't have employees, you can't operate at capacity anyway. From there, it's adapting to and planning for changing public health guidelines. And I know there had been a lot of discussion within the task force previously about when everything went into lockdown originally, how people were supposed to adapt, if you have to get extra sanitation practices, make sure people are wearing masks. And then again, losing business again popped up on there again as the other one. Overall, within the region, over 25%, so we actually have about 28% of folks aren't sure or don't think that they have the resources and information to bring employees back to work safely. So that's kind of a big number, although that is 75% of folks that do have the resources and information, which is fantastic. When a quarter of our businesses report that they don't feel like they have that, I feel like that's a really big education piece. And I know you guys have all done great on the PR component and trying to get PPE out to folks. But to me, that was a big percentage that we really need to look at and make sure our businesses feel comfortable reopening with their employees. Across the region, and this one kind of surprised me, I had figured childcare, people going back to school remotely would have been one of the top ones. The lack of available qualified talent was cited as the most anticipated difficulty in filling employment vacancies. There were also quite a few write-in comments regarding easy access to unemployment, or when the extra unemployment benefits kicked in, that some of their employees felt that they made more on unemployment versus actually coming into work. But the lack of available qualified talent was the number one across the region that people thought would make it difficult to fill any employment vacancies. Again, something that's a little bit interesting. So marketing and social media marketing was the most cited training or technical assistance opportunity for our businesses. We know a lot of folks changed their business models, but some of them just didn't have a social media presence before. And so this is just kind of getting them up with the times, as well as being able to adapt with what's going on. The use of technology to improve efficiency. Again, as we've seen business models change, if things shut down and you can only offer limited services and you have to have the technology to support that. Leadership or organizational adaptability coaching and training also was one of the top training and technical assistance opportunities that was highlighted. And so just making sure that as an organization you can adapt to whatever it is that life will throw at you. There's definitely a big interest in that. As Fanny touched on earlier as a business owner, and I know as Alice kind of touched on with the prioritization, all of the businesses across the region are saying, hey, we need faster access to vaccines. I don't think that's a huge shocker to anybody, but that is a predominant tool or resource that people listed that would help them survive and thrive in the future. So that is something to look at. I know there's not a whole lot that might be able to be done at the moment, but that is something our businesses are asking for and that they think that they need to succeed. I also wanted to thank the chambers and everyone for getting me some pictures of our lovely businesses all practicing safe measures out within our region, be it shopping or conducting just everyday business. This isn't a shocker either, but the industries with the most responses were those that were impacted the most, which is your retail, trade, and your food services. So when everything shut down, we did have that issue. The next one, so hopefully this one switched over to Riley County for you folks. So this is actually just breaking it down to Riley County. So overall, there were 39 respondents across Riley County. So 3 of the 7 businesses across the region that opened that responded to the survey were in Riley County. So that's huge. And I know I've been to a couple myself or gotten takeout from some of them. 53% of the respondents have been in operation for over a decade, which is fantastic. So definitely kind of those anchors here in Manhattan. Again, COVID exposure of staff and employees was listed. So staying on the trend with the region. A 59% decrease in revenue, but a higher increase for just maintaining than the rest of the region as a whole. So doing good there. 81%, again, they felt that they had the resources to bring employees back. So a little bit better than the region as a whole. But again, customer traffic and losing business were the top 2 concerns for businesses. Lack of available qualified talent, faster access to vaccines were the 2 that were listed again. And then here in Manhattan, we did have a pretty high response from our professional service providers. This one was also interesting to me because your accounting firms may fall into that category. The survey results, and you'll see this in the more in-depth report in the dashboard that we publish, a lot of folks get their information from their accountants, their bankers, and so on. So it's huge to have those accountants, financial institutions, everyone on board with all the initiatives that we do. About half of the people said we get our stuff from the local chambers, which is fantastic. So kudos to you chamber members and chamber employees. A bunch of people said, you know, I don't really know who to go to, or I just go online or word of mouth. And then a pretty significant amount of people said, hey, my banker or my accountant is feeding me this information. So that's a huge category to have, just kind of participating in everything that we do. Again, marketing, social media marketing, business model evaluation came into play here in Riley County, and building the existing team as well. So those were all big categories there. And then, sorry, let me move my Zoom toolbar. And when we hop over to Pottawatomie County, we had about 27 respondents. 52% have been in service for over a decade. Again, COVID exposure of staff was a huge issue there as well. But they also indicated that their target market is just avoided going out. And so that's a huge thing. If you can't get people into your stores, regardless of what you're doing, that's not good. And so that's where we hope to do a consumer confidence survey in the near future, so we can figure out what do the target markets need to actually go out and frequent our businesses, if our businesses are doing what they can to get folks in there. Again, customer traffic and losing business were the top 2 in Pottawatomie County. And then adapting to remote work and technology requirements was another big one. A little over a quarter, so on trend with the region, were unsure or felt that they didn't have the resources and information to bring their employees back to work safely. Again, lack of qualified and available talent is one of their biggest roadblocks to filling any vacancies. And then their training needs were a little bit different. So looking at developing policies and procedures, business model evaluations, use of technology to improve efficiency, and then knowing when to reduce your workforce and e-commerce. Also, theirs was a little bit different in this, where they did cite faster access to vaccines, but that was tied with payroll assistance as the most cited tools for their business to thrive. And they had retail and actually healthcare and social assistance were the top 2 industries that responded in their survey. And over here we have our lovely folks over at the Oz Winery. So like I said, we'll be going through a much more thorough report of the survey results, kind of go a little bit more in depth on that. We'll have an interactive dashboard online. And so that will hopefully all be published by Monday. But right now, if any of you guys have questions, I'm happy to answer them. Outside of that, I will definitely get all of those links to you guys Monday once that's all up and running.
Thank you, Marissa. That's great. Any questions of Marissa?
I have a question.
Oh, I'm sorry. Go ahead, Benny.
All right. So now that you have this information, I know you're still building dashboard, so I might be getting ahead. But what's next? What's next for business owners? What can we anticipate in terms of maybe services, information, resources, etc.?
Absolutely. So what we're going to do, and it's kind of unfortunate, a lot of folks responded that they didn't want any follow-up information after filling out the survey, but they took the 15-20 minutes to do it, which was surprising. But so the idea is to essentially create a toolbox if possible. So the easiest one, to be quite frank, is the training opportunities. So pushing out, okay, if we saw these regions say, hey, they need marketing, social media marketing, they need leadership training, if they need diversity training, which those were highlighted, just they weren't those top picks. Those are going to be the easiest connections for us to make. So that'll be kind of the first step in the toolbox of connecting with the SBDC, the university, see what they offer. From there, then it'll be looking at, okay, so we have, the biggest one was loss of business and customer traffic. So for us, we're going to be trying to push out that consumer confidence survey, because I'm sure as a business owner, if you guys are trying to do what you can and people still aren't coming, that has to be extremely frustrating. So we're going to be pushing out those resources. And then from there, we did have a pretty in-depth question, and thank you for taking the survey, about what resources that you've used before, what you might need in the future. And so from there, we're going to be looking through and saying, okay, X amount of people did PPP, X amount of people felt like they didn't need it, but what do they actually need? So then we're going to be going through and trying to find if there's grant opportunities, resources, anything like that. Honestly, the biggest roadblock to that is pushing out this communication to the businesses, because like I said, there's a bulk of those folks who didn't want to receive any updates. A lot of folks don't have social media, and that's where we push out the majority of our funding opportunities, is that and email blasts. So it's going to be a lot of sitting down, looking for grant opportunities that we can either assist with or push out to the businesses directly, and then keep going from there. So honestly, it's going to kind of look like a toolbox format with whatever folks need, and hopefully that will actually be helpful, because it doesn't really help if you create a bunch of links or resources and no one goes to it. So we're open for any suggestions from you guys on what the best way is to actually reach people, because we can have the best resources out there, but if we can't reach people, that doesn't really do a whole lot. So hopefully that answered your question a little bit, but yeah, we're hoping to get some stuff together for you guys.
I think one more thing I would like to add to that is when we launched the survey this last round, we said that we would do it on a quarterly basis so we can see the change in responses over time. And so as new resources come about, we'll use that survey to tie in as also an education and outreach kind of marketing tool to say, hey, in the last survey you said this, and now there's these resources over here to do this. To tie all that back together.
Thank you, Marissa and Christy.
So I guess, I guess as a comment, sometimes you know, we all get bombarded by emails and questionnaires and things of that nature, correct? I think, you know, sometimes when somebody needs to grab my attention, you know, other than text messaging, is a personal phone call. You know, it's just reaching out and calling people personally and saying, hey, just did you see that, you know, survey come across, you know, your email, you know, we'd really appreciate you just, you know, taking some time to, you know, fill that out. Sometimes a personal touch, you know, that way, rather than just distributing it, you know, electronically, always helps. I think if you want to get a little bit more response and, you know, follow through on some of your, you know, on some of this, because, you know, as you know, many of us, you know, for somebody like myself, whom doesn't spend a lot of time in front of the computer because I'm having to, you know, do other things, you know, a little bit more not sedentary and much more out there, you know, and having to do things. So sometimes just somebody personally calling, saying, hey, we'd appreciate you taking time just to do this, you know, et cetera, and just give them a deadline. Always, that's what I need, is a deadline. Just somebody telling me, like, just do it by then, and that would be great. So that's just a thought.
Yeah, thanks, Kelly. We did reach out to business associations and chambers, and we knew that not everyone's connected in that network necessarily, and so we actually invested in a product to be able to get contact information, both email and phone, of businesses that may not be in that network. So Marissa did a lot of legwork to put together those contacts region-wide, and so so we did as much as we could. With that being said, I think we also depend on everyone on this task force and those leaders of each of those groups to then also help get the word out. But yeah, I appreciate your comments. Thank you.
And I did want to make one last comment, because I do want to be transparent with kind of what happened with the survey. Probably one of the most contentious questions across the region was if you're a woman-owned business, if you're veteran-owned, LGBT+, Latinx, so on. And there were a lot of write-in comments on that one. So I just want you guys to know that if you're a business owner, that question isn't meant to exclude you from a category. It's to help find funding sources that might be available for whatever category you may identify as. So I just kind of wanted to throw that out there because I felt like some business owners might have felt disrespected by that question, but that was not the intent at all. So I just want everyone to know the intent of that is to kind of get a better understanding of the demographics out there, and if there are funding sources that can help. Generally, those funding sources are more targeted, so that's the intent of that question. So just wanted to throw that out there and thank everyone who participated in the survey. Like I said, hopefully we'll have some good resources for our businesses and some good insights, and we'll keep you all updated.
See, anything else for Christy or Marissa? Well, thank you for sharing that. That's actually that was very interesting. Before we moved on, just wanted to kind of do a few check-ins. Steve, is there anything from Fort Riley that we would want to be updated about?
Hey, good afternoon. I will just say that yesterday, on February 10, our Commanding General released his latest general order update. It changes nothing of the current restrictions. It fully implements the Department of Defense's latest policy on face mask wear. That's available on the home.army.mil/Riley website.
Okay. Perfect.
That's it.
Okay. Thank you, Steve. I was just gonna also maybe check in with Robin Cole, because we had quite a discussion over the last couple of meetings about mental health services and concerns showing up in the community. Just gonna maybe touch base, Robin, and kind of get an update from you about what you guys are seeing.
Yeah, we're continuing to see high utilization of the crisis stabilization unit. We are seeing that individuals who had been reluctant on the front end of the pandemic to reach out for services are starting to reach out for services. And so we've seen an increase in the number of people making first-time contacts with us to request mental health services. So we're starting to see those numbers return to pre-pandemic levels, and are scrambling to try to get people access to what would be seen as routine services.
Well, thank you for that.
Mm-hmm.
So going back a couple meetings back in December, we had that conversation and started, I think you guys probably remember, we started drafting out a document about lessons learned. And I know Lyle actually had referenced this too, just the importance of doing that. So, you know, and thinking back through that and looking at our draft, I think Dennis is going to bring that up. You know, so a lot of the lessons actually, or a lot of things we talked about, or a lot of things we documented now, have really been about the shutdown period, which certainly is very significant, especially as we're trying to understand what the heck was really going on, how severe is this and how's it spreading. We wanted to kind of circle back to that because we've all had, you know, another month or so to think about that, just to see, are there other things that people would want to add or make sure that, you know, edit, change, because we do think this is going to be one of the takeaways from our efforts from the last, well, now going on 10 months. So, and I know Dennis had sent that out to everybody last week. I just want to kind of open up conversation and see if anybody had any thoughts about things to change or additions, things you've thought about that we should add.
Bob, this is Fanny. I've sent you.
Thank you for being my icebreaker.
Not a problem. I missed the last several meetings, and so I didn't get a chance to provide my feedback, but to be transparent to the entire committee, I have sent my feedback directly to Bob and Jason back in December or January. And then Dennis told me that we were going to revisit this, which is great, so I can share some of the feedback that I have. Something I noticed that a couple words that repeat often in this document is that some of the protocols, restrictions were arbitrary and or irrational. And I can understand where people are coming from. And so I think that in the future, if this were to happen again, or as we continue to think about what we need to do to overcome this pandemic, that we match our actions with some type of data. Yes, there are some, for example, with bars closing at a certain time. Yes, we can all say that past a certain time, you know, there's you know, the alcohol intake at bars may be higher. Sure, I mean, some of us may agree with that, some of us may not. So what's the solution to that? I think it is providing some type of data to explain those actions. I understand that puts a lot of work on our health department, on our police department, who are, you know, very busy with other things as well. But I think if we are going to ensure that consumers are confident in our actions, that we need to be able to justify what we are recommending.
Other feedback from the group?
This is Kelly. I just also want to say that, you know, kind of what Lyle.
Are we all having trouble hearing her? Did we lose her? Yeah.
We lose her, actually. I think she dropped.
Yeah, I think so.
Oh, there she is. Oh, frozen.
She is.
while we try to get her reconnected, feedback from anybody else?
Yes, I do have some feedback, and I'm not sure if this issue was addressed. I don't remember if we talked about the issue in the document or not, but Ned Seaton wrote an interesting editorial this last week just on the county health department, its relationship with the county commissioners. He didn't refer to the Public Health Advisory Council in name, but did make some references to the Public Health Advisory Council, and made comments that referred to, I guess, basically, or that raised questions about what its level of influence was in health department issues or decisions relative to the pandemic. And I'm not sure what needs to happen, but I do think there probably needs to be a conversation about this issue. You know, we're very fortunate in Riley County in that we did not have, we didn't face some of the challenges that lots of counties in Kansas did around similar issues that Ned identified in his editorial. There was a high degree of turnover in public health department leadership in other parts of the state. There were reports of county health department directors receiving threats or feeling threatened by some of the remarks that were made regarding decisions they were making or leadership they were trying to provide in their county related to the pandemic. And so again, I'm not offering a solution, but I do think that a lesson we need to learn from this is that we probably need to be, and I'm not sure that it's this committee or it's not this task force that needs to have this conversation, but I do think there probably needs to be a conversation about some of the issues and dynamics that he identified in his editorial this week. And that's probably a discussion that involves the health department, our county commissioners, maybe the medical task force that was formed early on, probably the Public Health Advisory Council needs to be involved in that conversation. So there's probably at least 4 bodies that need to talk.
Robin, I'd like to follow up on that. I agree with you. I feel that given the talent and skills and institutions that we are so fortunate to have in Riley County, I do feel that for example, the Public Health Advisory Board was underutilized in all the ways. I think that you know, this obviously is such a pivotal moment for our community, and yet when health professionals, when the experts banded together and spent time to come up with recommendations, it often felt like the recommendations were ignored. And so I think that is part of the divide that we're seeing in our community on whose information is accurate, who should we be listening to. And so, you know, I think you bring up a good point, and I appreciate you bringing that up, especially as we look into the future on building this community, that we do need to work together, and that if we are going to establish an advisory board for public health or for whatever it is, that we turn to them as experts rather than just having there to serve, to have it as a credential.
I might chime in.
This is Julie, and I just want to say that I think there needs to be some acknowledgement that despite a certain amount of resistance, that we have had leaders on the city commission who were listening, and I think a very important thing that did happen was the mask ordinance. I think that was key to reducing the number of incidences to COVID. Obviously, everybody had to do their part, and I just want to acknowledge the folks who not only had to make that tough decision during what was some very interesting divisions in our community, but also the people who supported that decision. I mean, it's been tough. As we all acknowledge, nobody really likes going around wearing masks, but you can't really fight the fact that having that mask ordinance contributed significantly to reducing the number of cases that otherwise would have been happening in our community. And I just felt the need to make that acknowledgement and that statement.
Can you all hear me? This is Kelly.
Go ahead, Kelly.
I just, yes, I think, there's a lot of goods, that's come out, from having, this advisory, committee. I hope that everybody, feels the same way. I would agree that, there does need to be an ongoing collaboration, with health advisory, board, moving forward. I guess, just as a comment, as a business owner, and talking to other people in particular this industry that Russ and Kelly are in, it's been hard. It's been hard, doing the 6 feet, the distancing, having 50% occupancy. But what I want to say is that it was always about the health and safety of not only our staffs, ourselves, but it was also the health and safety of the community. And there's just kind of a moral compass. I think that I hope that many of us, as business owners, will take in pivoting, ourselves around the health and safety of the community. It may take a little bit longer, maybe to get to that point, but I do think that overall, we are moving forward, to make our community safe, to where we can really reopen, to get back to some point of, whatever normalcy may be. But it's, we also would not, as I had mentioned earlier, we would not be here if it would not have been for the swift actions of the PPP, our local Chamber of Commerce, looking out for us, the Raleigh, all of the things that we've been very fortunate to have. And, I think there's a lot to say about our leadership making some very difficult decisions, and I applaud, our governor and, the city commission and others whom really embraced science, and knew what was going on. So now we have, some of this infrastructure built in our PSAs and getting out there, and I think you just continue to need to build upon that and to move forward on that. And, and keep, just to remember that it's really about the health and safety of not just, our community, but with our businesses and everything else. So thank you.
Hey, Bob, I was going to bring this up under emerging issues, but the way this conversation's going, it's probably more relevant now. We are starting to get a lot of questions from our members. We have around 800 members, businesses, who understand everything that was just said, and while there was a lot of sacrifice and they're working very hard to keep their businesses open, they're wondering when and how. And I know Dennis just put something in about the EOC, but in light of Fanny's comments earlier, what data and what metrics will the EOC use, and have they started that process to start lifting restrictions in a very thoughtful way? Because our businesses have no idea. I mean, I had one the other day said, "Is this just going to be it forever? Are we?" And it's like, "No, I don't think it's going to be it forever." And he said, "Well, how do we know? What's the conversation?" And that is becoming more and more prevalent in terms of phone calls I'm receiving. I don't know where Dennis and Gina are on that from their members, but that would be something that I think is really important, and probably a conversation that will take place outside of this group, but it would sure be nice if our members knew that there was some metrics that was being established, so they could start planning their long-term goals and how they're going to reopen safely. And so I don't know if that's an EOC discussion. I don't even know who the discussion's with. And I think it would be helpful if at least there was some transparency in that process so that people understood what was going to happen.
May I actually chime in on this one? I have a little bit more information, and maybe we'll answer bits and pieces of it, maybe not specifically at this point in time. I will share with you that a conversation is in place currently, and it's still being discussed. And it will be a stepped or a phased type of plan at this particular point in time. We're watching kind of what's happening right now. I don't know all the metrics or all the variables that are in place that will start that and get that process moving, but we are at least tentatively, and I want to say tentatively, discussing that as being a new local order, probably number 20, that would come in early to mid-March. We will give the community and the region ample opportunity to know what that is in advance so that they can plan, and then to further plan and what that entire phase plan is going to be. Like I said, I don't know all the specifics just yet. It's still being discussed, but we effectively know that with numbers going down and a vaccination process in place, that this is a natural conversation and direction we need to go, particularly as we kind of work ourselves into spring. With all that said, I know that our EOC has just started to discuss that this week. There's some T's to be crossed and some I's to be dotted, and those metrics and those variables will have to be kind of laid out. But that conversation is in place, Jason. And in fact, we discussed it just a little bit in executive session this morning, as a matter of fact. So I'd be looking for that here shortly, maybe within the next couple of weeks. We're kind of looking at, kind of depends on what's going on currently. We know that there's been kind of a decrease in testing, so some of those positivity numbers are kind of like based on that. We just had the Super Bowl. Sorry, Chiefs fans, I'm not trying to rub anything in at this point, but we don't know what that's going to lead to. Obviously, the university just opened back up, so we anticipate a kind of a bump or a small spike. I don't think it's going to go through the roof or anything. And of course, as we've always been wanting to watch, we want to watch hospitalizations. I know Bob is carefully monitoring that as we move forward. But at least the early discussion is sometime early to mid-March, there should be some metrics in place that will start guiding us through that process. So I hope that kind of answers some of those concerns. Believe me, I'm starting to hear that myself. I'm starting to get phone calls and emails. I'm sure members of our EOC and health department have too. So it's not been ignored, and it's currently being discussed, and will be more so addressed as we kind of work through the rest of February here. And would point out too, as far as other metrics to watch to get to that point. Obviously, with the extreme cold right now, this is one of my concerns. It obviously puts people inside because most of us don't have that North Dakota type of skin at this point in time, and it's been quite a long time since we've had this type of cold, so we're probably not adjusted to it. So obviously, people are going to be inside more, and there's going to be a concern. But if we can get through those three specific points, I think in the next few weeks, I think it still opens back up, and with vaccinations still working and everything else, I think we can get to that conversation that's happening. It will be a little bit more defined, and we will, and I've asked to make sure that this happens, that we get it out in advance of anything that we do, so that everybody in the community, whether you're a business owner, whether you're a person, whether you're working in the private or public sector, will know well in advance of what that plan is and what everything is that makes it move forward. So hopefully that answers some of that question. I figured this would come up too. So
yeah, no, I appreciate it. Can you just, and I know you are the ultimately the county commission is over those decisions through their role as the health authority. The recommendation will come, does that come from the EOC? And maybe is there a way, who is on the EOC exactly? I don't know that that's a public, I don't know that that's people are well aware of in the public who actually serves on that committee.
Sure. Julie Gibbs, of course, is on there. David Adams is on there. I think Russell Stuckey, our emergency management person from the county, is on there. Scott French from Manhattan Fire is on there. I'm missing a few people here. Kurt Moldrup from RCPD is on there. And I'm missing one or two right off the top of my head here. It's not hitting me, but it's a diverse group within the range of the community. So it isn't just all health department, but it's basically all those that have a vested interest in kind of the emergency management process. Bob probably can fill in the other ones that it seems to be slipping by me here.
That part would defer to Ron, but yeah, I guess just a couple of, what'd you say, Jace?
Well, I just, Commissioner Ford was very, had a lot of foresight early on and helped create a business advisory group that could be contacted by the health department on those issues. And I know Gina and Dennis and I all submitted names, and they picked a few. Do you know if they're being consulted? And I mean,
when I had a conversation with David about that, I did ask about that. Particularly as we're getting kind of into spring indoor and outdoor event season. That was a particular concern for me because I know how much that has been lost over the last year and how much that probably needs to be reincorporated. And we've had some calls from the various convention centers, hotels and this and that on that too. So yeah, that was a direct question I asked to make sure to involve them, at least in how some of those, the metrics are going to be health and science based, and they probably should be at this point in time, to be honest with you. But in terms of how to safely and effectively incorporate the two, because let's face it, over the last year, it's just been a night and day, apples and oranges type of thing. But in order to try to get it as efficient and effective as we possibly can, having that insight is key. And I think we actually put that committee together right before we came out with Local Order 18. And that was in August, just before the beginning of the K-State semester. Since August, one could argue whether or not that was the right approach or not the right approach, but realistically, we've already crossed those bridges. So where we're at is where we're at. We need to find that happy medium to move forward so that we do so with safety in mind, and we do so effectively so that everybody can start moving forward and we can get back to some sort of normalcy, whatever that actually becomes.
Hey, John, it's Linda. Do you know, I know Kansas Department of Health and Environment plays a key role in trying to determine how we open the state. And I know you sit in on some of those meetings. Are they starting to look to that state plan? I know there's some legislation going on
It
Right
looks
now,
like to me that KDHE is actually kind of doing the same thing themselves right now. And most of the metrics, at least early, were based off of CDC guidelines, and then KDHE has kind of worked off of those and kind of incorporated the state of Kansas into that equation. I know that there is it's either this afternoon or tomorrow, KDHE is going to discuss some updates to a couple of things. It was real general. I was assuming it's probably on the vaccine plan first. And so maybe some other things will come up along with that in terms of how to move forward. I know that there's some other counties at this point in time that are already starting that process. I know legislatively there's some things on their agenda right now that are trying to push, as the legislature last year took kind of the executive powers from the governor and then kind of dispersed them back locally here and put it into our laps. Well, that was a good thing or a bad thing. It'll probably take years to debate on that to figure out, but we are where we're at. With that, from my opinion, they're seemingly wanting us to open things up. I can't speak for the other 104 counties, obviously, but we need to do what's, in my opinion, safe, practical, and efficient here. So I know the health department and EOC will use all those guidelines to kind of set up those metrics as we move forward. And if those metrics aren't met, or we take those 2 steps forward and have to take a step back or something, then, they're going to be based off of that. And that's the direction that we would go.
We also have the clinical task force that's advising the health department and the EOC. So there's a lot of input. I guess the observation I would make is a lot of this, as we got into it, we learned from other communities that had faced it and what the impacts were as time went along. We don't have that history on vaccines and how quickly vaccines and different aspects. And so you can't just reverse that because there's not that history. Now you could kind of make some general characteristics. So from my opinion is the clinical task force and the medical experts are still going to be a key influencer of what that policy should be.
And we do also have a medical doctor on staff that's along with the clinical task force and the health department also makes some recommendations. I think unlike the mask, obviously vaccinations have been that key component all along. I mean, we can debate either side on the other one, but from day one, we know that we had to have a vaccine in place to even consider what we're talking right now. And so the fact that we have that in place, we obviously, that's whether or not we have metrics or variables in place, how that goes will obviously play a key role in being able to move forward and lift some restrictions and get back to normal. So
I think a key part of that is continuing to message in the community the importance of when it's available for us that we should all get vaccinated. I mean, that is a key piece of all of this. It's kind of a foundational issue. If we roll into July and we have 50% vaccinated and we have a vaccine sitting, that's a problem. You've got to keep ahead of that.
Yeah, one of the other things I mentioned this morning too is to continue education on what the vaccine process is. There's still this notion that you get a shot, or you get that second shot, and all's well, and we can fly open the doors. And we need to, as part of that education process and as part of that communication and dialogue, we still need to consider that you're going to take a first shot, depending on which one it is. It's 21 or 28 days, and then there's a 12 to 14 day period after that, and there's still a 5 to 6% that the vaccine isn't going to work, and they still could get sick. So it's not a guarantee. Even if 100% of all Raleigh Countyans are vaccinated by this weekend, it would still be at the very earliest mid-March before you could even think about opening up things. So we still got a long ways to go. I think we've come a long ways, obviously, but we still have to take all those things into this approach, whatever it may be. And like I said, if it starts to slip one way or the other, we start to see increases, then we have to kind of roll things back. So a cautious approach, particularly to start, is probably going to be most effective. And as we hopefully work into the spring and summer and more people get vaccinated and we continue to watch percent positivities and what happens at the hospital and the other healthcare infrastructure, hopefully we can continue to do that. And I don't know how many phases will be part of this. That's a discussion that's still ongoing, but it will be a phased type of plan. So this set of metrics. Okay, we got to this point, everything's working. The next set of metrics, everything's working, or it doesn't, or we need to hold back. I don't know that there's an easy way of going about this, but to me, this seems, considering where we're at, probably the best way.
So I have another question in regard, is the EOC a public body whose meetings are open?
No, those are all actually basically appointed officials. There's nobody elected on those positions.
Okay, but well, there's not here either, and we're a public body, and we're videoing all our meetings. But so the one of the concerns, and I know we started out with this group being regional, and unfortunately, we lost our other counties. But I know there are some instances where we particularly larger events who are asking for permission to have those in Manhattan, and they're being turned down. But we know Geary County and Junction City are allowing them. So I'm not sure we're protecting our regional health issues by restricting one city when we know another city is going to do it. Is there an answer for that? And I hate to.
No, I asked that same question actually more locally, because we've had that happen where they've put in an event request for a certain event with a certain amount of people and it was accepted. And then they said, okay, well, yeah, this will work. So when they're talking to somebody that wants to come into town and it's something similar, they say, oh, yeah, that should work. We've done this already. And then they put in something similar. Actually, there was an instance where the conference was actually less of a number, so it should be distanced out a little bit better, and then that one was denied. So there does need to be, and I've asked that we have some consistency with that dialogue and communication too, so that as we plan those things locally, whether it's another city or not, I don't know if I can answer for that, but at least what we're doing locally is both consistent in that dialogue and communication, so that when we are talking with a group that wants to come in here, we kind of have that foundation put into place, because I don't think it's been there all along. And that's just something that we do need to work on, because I do know that as we're getting into spring and summer events, whether they're inside or outdoors, are going to start to occur. And that would be a natural part of that, is to have that in place. So
it's just an awful lot of power for one group that doesn't have to be accountable for any decisions. And I think I feel bad for the county commissioners, because you all are basically the ones who have to sit in front of the public and answer for decisions that are being made by an unelected group of people behind closed doors.
Yeah. Well, and of course we have the County Board of Health, and it's taken me, I'll be open and honest, it's taken me a long time to figure out what all those duties and responsibilities are myself. I'm not a public health expert. Nobody I've served with in this position so far is. So that's why you have these different levels. I think to maybe answer some of those earlier questions about directions to go and advisory boards and everything else in regards to this, I think when the dust settles and some time is put in between this, and we get back to something normal and something stable, I think those conversations of how that should go in the future for future pandemics is going to be discussed. And do we have the best setup at this particular, and I'm not just talking locally, I'm talking statewide, I'm talking nationally, maybe even globally for that matter, if the process that we have in place is the one that's going to work, because I think in some instances it probably has, but in a lot it really hasn't either. So there's a lot to consider on this point moving forward.
I appreciate you always being willing to stand here and answer these questions. I think the fact that they do not creates distrust in the system. And the last thing we need with all the national stuff going on is more distrust in the system.
Sure. I will always try to do what I can to, to be open and transparent with these things. Right now, this conversation is still rather primitive, so I'm not trying to hide anything. I don't know all the dynamics just yet, and I don't think it would be fair to mention those until we actually have them in place. So
thank you very much, Commissioner. I appreciate it.
Mm-hmm.
One other thing I guess I'll share. I was texting back and forth with Julie Gibbs yesterday. I do think people do need to take heart in the fact that we are actually starting to make movement. They're, I think, giving 600 vaccines today, around 600 tomorrow. They had another clinic earlier this week, and we are going to actually as things are now kind of kicking into motion, and it's all about supply. They have to have vaccine to deliver, but we are, I think, starting to make inroads in specific segments of our population, and we're going to have more and more people vaccinated. I know for us, we've given 800 first doses and 600 second doses. And another 2 weeks, we'll have given the other 200 second doses. And that actually depletes our vaccine. We're going to be out. But, you know, we've touched 800 people then, which in our county that's a big deal. And I think that's the part of this is kind of getting us on a path. Our census today is about where it was about 3 weeks ago. The difference is 3 weeks ago, 50% of our census was COVID positive. Today, it's around 6%. And it's just the natural ebb and flow somewhat of our work. We're certainly, I don't know that any of us can say exactly why we're seeing what we're seeing, but that's also, I think it's some of the fluidity of the situation, and people have to kind of appreciate we're seeing an improvement. Actually, we're seeing improvement across the state, which is great, but we're seeing improvement locally. And I think also we all kind of hold our breath, see what's going to happen, but that is how fast some of this is actually changing. And you're trying to be adapting to that. Our ICU census is about what it was 3 weeks ago. It just has different people in the beds now who aren't necessarily COVID positive. But earlier this week, we're at 100% capacity in our ICU. So 100% is 100% in our world. It's just still, how do you keep working with that and keep kind of managing it? And we are grateful that we only had 3 positive patients today. That's a huge deal. But I do think, yeah, the fluidity, I'm not sure people appreciate. And also the weather is not helpful this week, and for some of next week, it's not going to be that great either. But I appreciate the fact the health department is pushing ahead. You know, I had to leave to get the teachers because we're starting our first group of teachers today. That is a big deal. It's a huge deal. Again, it's foundational, I think, to getting us move forward. And that does position us by the spring, the summer. We literally will have tens of thousands of people vaccinated in the county. And so that I think is the shifter at that point. Really changes our conversation. But we got to finish the deal.
Yes. I may mention one thing too, Bob. You mentioned that in this process of a vaccination, we haven't wasted any. They've gone into somebody each and every time. And there was one other thing I wanted to mention, and one other thing that we are working on too, because of the inclement weather, so that we can keep up with both our RADx and our well health testing. We are going to work on getting everybody back together on that master lease, which was supposed to be for our ACS site, and trying to open that up for a testing site so that there's an indoor facility to be able to use to continue on with that process too. If we can get that done shortly here, I'll be able to get that paperwork signed and get that into place, hopefully as soon as possible, as long as everybody agrees with it. So we could have that up and running there at the old Regency Hotel site back there off of Tuttle Creek Boulevard, hopefully as early as next week, if need be too. So that'll continue with that process too. And we decided this morning that that was important enough to consider, more so than just having a congregate site at this point. So then that shows you how things kind of change along the way. That was an important part. It wasn't something that we used, but we had the lease in place to use it. We have the funds to be able to do it. So if we can use it for some other matter to help work through this process, then we're obviously more than willing to do that.
So we have just a few minutes left. I know we have our meeting scheduled in March, but wanted to just ask, are there other topics that we would either want to surface for next agenda or for us to do some work on in between time?
Hey, Bob, this is Dennis Butler.
Hey.
Yeah, before we go on, the conversation we were just having, I think, started when we had the document up talking about the things that we learned as we went along. And I think it's just important to acknowledge in this group that the playbook was being written while the game was already underway. And I think we did a yeoman's job with everybody involved in this, whether they were on the EOC, especially the EOC members and others. Nobody had the answer. We learned a lot as we went along, and I think we're better for it moving forward. And I just think it's important for us to acknowledge that, along with the frustrations that occurred along the way in a variety of areas, whether it was business, education, law enforcement, healthcare, you name it. We were all struggling and working and doing the best that we could. And I just want to applaud everybody who was involved in that effort. That's all I have to say. Thanks.
I have, oh, go ahead. Go ahead. Go ahead, Gina.
Okay. I just want to take just a minute to acknowledge John and Commissioner Ford and his leadership, and specifically addressing some of these questions today. There is certainly, I think we all sense in Manhattan and probably in the state and in the United States that we're seeing light at the end of the tunnel, and there is positive feeling that we are getting to the end. And I am, to answer Jason's question, certainly getting those phone calls about what are the next steps, how long is it going to be like this, what are the benchmarks used to determine when the economy can reopen. And I think, though, really more than that, though, or maybe not more than that, but in the same breath, almost, it's yes, we want to know what the benchmarks are, and it's absolutely important to the livelihood of the local economy and the livelihood of individual small business owners, but we've got to stay the course, and we cannot lose the ground that we have gained all these months of just nose to the grindstone and following our local leadership. They have not led us astray. We've had some blips along the way, but I think for the most part, it's really important, speaking for downtown businesses, that we get to understand what those benchmarks are. It would be great if someone could sort of lay those out for us. You know, what percentage of the population has to be vaccinated, or whatever those benchmarks are. That would be awesome to know. But also just staying the course and not giving up the precious ground that we have gained, and the consumer confidence that we have earned, and the business that we do have is really, it's really important that we not mess that up, but that we continue to have the tools we need to continue to move forward. And that's what I want. And everyone who's been involved in these hard decisions, I really, really want to thank you for your leadership across the board. And John, thank you for always picking up the phone when I call you and ask you questions. And many of you on here are that way. So thank you very much.
Yeah, I thank you, Gina. I appreciate those words. I may mention one thing too, just as a caveat to what you said. It is very important not to lose focus at this particular point in time. It feels like an eternity, but it's really only been close to a year. But we don't want to make kind of a unstable or situation worse at this point in time. So we've got to still stay focused, and we still got to stay mindful, and we still got a ways to go to get through this. And I also think that the foundational approach, whether it's been good or bad or indifferent along the way, is going to set a tone for anything that happens in the future. There's going to be future generations when this happens, well after all of us are here, that are going to look to this time both for something good and maybe for something to improve on when those situations happen. So it isn't just about the present, it's going to be about the future and well into the future on that too. So it's important that we continue to work and stay focused, but it's also important that we do this right moving forward. And my goal is to continue to move forward and not move back at all. Once we're there, and we keep going. And these are the type of things that we're going to have to work and discuss to get there.
So I've got an emerging issue I like to bring up, and I'll be honest, I was not sure if I wanted to bring it up in this capacity, but considering that all of us, if not most, considering all of us probably have clients, students, employees, constituents, neighbors who are Asian and Asian American. I do believe that what I'm about to say is relevant to this group as we talk about the Recovery Task Force. To be quite frank, this past week has been very hard to be an Asian American. There hasn't been a lot of coverage about this, and so I want to bring it up here that we've seen a rise of anti-Asian violence towards us, and it's just gotten worse. I mean, it's been a year since this pandemic has happened, and somehow, some way, it just feels like, as an Asian American, I as a business owner, yes, I see the light at the end of the tunnel, but as an Asian American, I am, I don't know where that light at the end of the tunnel is. And I'm getting emotional because this week was, tomorrow is supposed to be Lunar New Year. It's a major holiday in Asian families, but it doesn't feel very celebratory for us because of all that's happening. And I'm bringing this up because we have seen, we've had incidents in this community where anti-Asian rhetoric has been shared publicly, and privately, you'll never, privately, I mean, it happens all the time. There's a reason why my business doesn't have our phone lines on, because we don't want to get calls blaming us for the pandemic. And it's been a year. So my ask to all of you to help us move forward is to just be more intentional when you think about how to support our diverse community through the pandemic. That one solution for a particular group doesn't mean it works for everyone else. And as individuals, check in on your Asian colleagues, wish them a happy Lunar New Year if they do celebrate. It's usually a time where we pay respect and visit our elders, but obviously for obvious reasons, we can't do that. And so I don't mean to end this meeting in such an emotional note, but something that has been weighing very heavily on me, and I'm looking to all of you for support. Thank you.
Well, thank you, Fanny, for saying something. Certainly, we don't want that in our community. So, Jason, anything else before we need to wrap up?
Nothing from me.
So I think we're scheduled for Thursday, March 11th, 2 o'clock. Well, thank you guys very much.
Thank you.
Everyone, thank you.
Bye.
Stay safe and warm, everybody.
Happy Fat Tuesday.